Hello, I am Ashley Freeman, the Manager of Stakeholder Outreach and Engagement here at the Patient Advocate Foundation. And our next story excerpt comes from Dr. LaShyra Lash Nolen. And this is an excerpt from our Advocates in Action podcast that I have the pleasure and honor of being the host for. So today you'll get to hear a little video excerpt as well as some pictures to hear about Dr. Lash's beginnings and her journey in medicine and the different impact that she has been able to make. But this is just a small preview of a longer podcast. This is a part of our 9th season of the podcast. So in the chat below, you'll be able to receive a link where you can listen to the rest of Dr. Lash's podcast, as well as all of our podcasts. So dive into those full 9 seasons and enjoy this next excerpt.
My name is Dr. LaShyra Nolen, but everyone calls me Lash. I'm originally from Los Angeles, California, and I think that my story and background really starts with my mom, who is an incredible woman. Her name is Ty Harps. She raised me as a single parent in Compton, California, with the support of my grandmother and our family in LA. She was the first person in our family to both get her bachelor's and her master's degree. And it was really growing up seeing the emphasis that my mom put on education that helped me understand that I can do this too. When I was around 8 years old, that's when I decided that I wanted to become a physician. From that moment, my mom and my grandmother, they just breathed so much life into that dream. They never made it seem like it was strange or impossible that I wanted to become a doctor. And I think that audacity to pursue any dream in my heart is really what has allowed me to get to the place that I am now. Last year, I graduated from Harvard Medical School. While I was there, I was the first Black woman to become student council president. There, I was able to start initiatives such as We Got Us. And really, We Got Us was an opportunity to organize young people across the greater Boston area to make sure that folks in our community had access to trusted messengers during the COVID-19 pandemic. And everything that I've done, I've really tried to just center uplifting patients, uplifting my community, and making sure that I'm centering liberation and justice and all of those things. So now as an internal medicine intern, almost resident at Brigham and Women's Hospital, those are the things that I've been focusing on. And I just feel very thankful to be here. And I feel so blessed to have the women that I did in my life to help instill those values in me. I remember distinctly when the vaccines first were being rolled out toward the end of 2020. I was getting a lot of calls from family members. They're like, Shyra, what's up with these vaccines? Do we trust them? It was in that moment that I realized this unique space that I was starting to occupy, where me being a Black woman in the United States of America, I understood the context and the heaviness of something being created with the support of government and being offered to people to put in their bodies, and the heaviness of medical racism that our people experience every single day. But then in addition to that, I was this Black woman who was at Harvard Medical School, who recently went through microbiology classes and immunology classes where we learned about how a lot of the technology behind these vaccines came to exist. So I was able to be this interpreter in some ways on both sides to help one side understand the struggles of the other, and then also to really be an advocate for my community. We need to get trusted messengers in our communities, and we have to change this narrative about how we're talking about Black folks and the vaccine. So I started to talk to different foundations, and the American Board of Internal Medicine Foundation gave We Got Us his first grant of $10,000. From there, I basically got an email list of student groups across the greater Boston area, reached out to them with this Google form that was of interest. We had this online webinar about what We Got Us was going to be. There was so much excitement around it. Before you knew it, we had this organization of young Black folks from across the greater Boston area, all committed to health justice and equity. Our motto from the very beginning was convey, not convince. We didn't want to try to convince people to get the vaccine, but rather convey information about it that they might not have had access to before. And we had an education team that was in charge of curating these empowerment sessions around the history of medical racism, the process of how the vaccines were created, and offer community members a space to ask any questions that they had about the vaccine. It was just such a rewarding experience. The biggest lesson that we learned from that is right now we're in crisis mode. There's a lot of funding, there's a lot of interest in serving Black communities, but what happens when we're no longer in crisis mode? That's why in the back of our mind, for We Got Us, we also acknowledge that all of the inequities that we were seeing in our community, it was just being further exacerbated by this virus. Our community struggled long before COVID, and we knew that they were going to struggle long after. And that's why we knew that We Got Us had to be a sustainable initiative. So every year since 2021, when we started, we've tried to find intentional ways to grow and to be a sustainable force in our communities. So when systems fail, we're always going to be there to help pick up the pieces and make sure that we have each other's backs to make sure that we're healthy and fulfilled and have the opportunity to live joyous lives. The way that I've really found strength in this moment is just leaning on the work of our ancestors and the folks who've been in this work longer. It just seems like it's just chaos every day, right? And I think that that is by design. It is to try to make us feel like our worlds are destabilized. It's to make us feel confused on how to move forward and to make us feel like we're paralyzed. I've done my best to try to stay out of that mindset. We still have to continue to put one foot in front of the other and control what's in our locus of control on the day-to-day and not allow the frenzy and the political theater that's happening to distract us from what the ultimate goal is, and that is liberation and self-sustainability for our communities. And we can do that work regardless of who's in office.